dating a guy with severe ADHD. I was so confused.
ADHD itself is a neurodevelopmental issue, meaning that we're born with it, but the activation happens throughout life. ADHD symptoms can mimic other psychiatric conditions like depression, like anxiety, like trauma, like sleep disorder. So in ADHD, emotions are very intense. As your IQ is higher, you're able to mask. The higher the IQ, the harder to diagnose ADHD. ADHD, it's constant. It's not something that comes and goes. It's a constant battle. That constant feeling puts a lot of strain on you and affects people around you.
Do you have ADHD?
I got diagnosed at age 40. The thing about getting diagnosed older is that you wonder what you could have done if you were treated early on.
Hello everyone, welcome back to WellSome. In today's episode, I have the pleasure to have with me Dr. Omar. Welcome to WellSome.
Thanks.
And let me explain first who's Dr. Omar. Dr. Omar is an American board certified family medicine consultant with special interest in mental health conditions. And the reason why I invited Dr. Omar on the podcast is because now more than ever, we want to know more about a condition that I think is one of the most popular when it comes to mental is ADHD. I am sure that maybe one or twice in your life wonder, do I have ADHD? There's a lot of rumor behind this word, behind the symptoms and behind everything that is connected to ADHD. So we are here to actually explore what ADHD really is, the symptoms, and everything that you have to know so you can actually either get tested or understand if this is only, distraction or you really have ADHD. And I'm the first one who wants to actually understand if I have ADHD myself. So let's dive deep into the conversation. Dr. Omar, this was a podcast this podcast was so everyone was looking forward for it. So Dr. Omar, first question for you. Everyone is talking about ADHD right now because, it's not a secret that our attention span is lower than ever. However, I don't know if people really understood what ADHD is. What is it?
So I like to call this ADHD beyond the noise. Because ADHD, there's a lot of noise with it. So I really appreciate that you're having me here. It's something now that's, there's a lot of information about it, but I think there's also a lot of misunderstanding.
I agree.
So ADHD, it's not only someone jumping off the walls or someone that can't sit still or someone that has inattention.
Yeah.
It's really a condition where you're having issues with executive function, with planning, organizing, task completion, task initiation. So there's a lot of procrastination as well.
Yeah.
And I think what happens is people hear about certain symptoms and they start, connecting the dots and saying, oh, well, maybe I do have ADHD. But it's far beyond that. You have to have a certain number of symptoms to actually reach that diagnosis. It needs to be done in the proper way. And ADHD really affects all aspects of our lives. It's not, just at work or just in relationships, or just studying, for example, because there's a big connection with kids and ADHD.
Yeah.
But it affects every aspect. And the more we know about it from trusted sources, I think the better we can understand it.
Yeah.
And the better we can cancel out the noise that's telling us, oh, you definitely have ADHD, and hearing that a friend has it, so maybe I do have it, without knowing for sure if that's the condition and if you would actually benefit from, knowing that it's there and actually treating it.
What's the name ADHD stands for?
So ADHD is Attention Deficit Hyperactivity Disorder.
Yeah.
And there's an old name for it, which is ADD.
That's why. Good that you pointed it out, because the next question was, what's the difference between the two?
Exactly. So they're actually the same thing.
Okay.
But what happened is, as DSM, updated, the ADD name, which was more, ADD describes little hyperactive boys.
Yeah.
Because boys are known to be hyperactive, they're getting in trouble, they're running around.
It was more, let's say, not it was more like, this is category.
This is the category,
Yeah.
exactly. So then when you say that, where's girls in this,
Yeah.
which obviously doesn't make sense.
Yeah.
And that's why the name was, modified or updated to ADHD, which is the full name. And ADHD itself has types. So the three main types are ADHD inattentive type, which means that the main issue is focus. ADHD hyperactive type, which the main issue is hyperactivity. So having trouble sitting still, fidgeting, running around, the typical that everybody thinks about. And then there's a combined type, which people don't even realize that I could be hyperactive and I could be inattentive at the same time.
Yeah.
And in adults, it's even harder because in adults, hyperactivity actually shows as impulsivity and restlessness.
I
So
see.
impulsive, restless equals hyperactive. But in adults, because we know how to manage our hyperactivity, imagine yourself waiting in line at the grocery store and you're just fidgeting around and then people look at you like, it just doesn't make sense because then you come off as, unstable, I guess, if you want to call it that.
Yeah.
But impulsive, restless is the hyperactive in adults. And in kids, they're being kids. We say that hyperactive is just being a kid,
Yeah.
And that's why it's actually much stricter when we diagnose ADHD in children. You have to give them some leeway. So you're not looking for as many, or actually you're looking for more symptoms than just, the few symptoms that we might use for a diagnosis in adults. So kids, you have to give them that leeway of their children. They should act like children. They have the right to act like children.
Yeah.
And part of that is, jumping around and, having their
play,
moments.
yeah.
Exactly.
Yeah.
Their sugar rush, as
Yeah.
kids, we say they have their sugar rush.
Yeah. Dr. Omar, why do you think now ADHD, it's so, everyone is talking about ADHD. Why now gained so much popularity, I would say?
So I think it's a culture shift, especially when you, like, for example, when I diagnose an adult with ADHD versus a child, usually adult will tell me, I come from a home where we cannot talk about mental health. It's not something that we're allowed to discuss. We don't treat mental health. And I think the culture shift happened. And definitely social media, so TikTok, Instagram, did help put people that are experiencing or that know they have ADHD for sure in the front line.
Yeah.
So when we watch them, we can actually relate to them and we can see our lives reflected in front of us. And that's something that didn't exist in the past, in addition to, the family kind of constraints and saying that, we don't talk about mental health.
Yeah.
This is not, something that's discussed. It's not something that's treated. So it was kind of blocked from the get-go.
Yeah.
And the other thing that's happening, I think, is that adults are reaching, stages in their life, different stages. And when they look back, they might have been successful and, well-liked and, have a good social life, a good job. But they still did that despite their ADHD. So they were missed, they were missed in assessment. And when they start seeing these posts and reading about ADHD and having friends that have it, because it's a whole culture shift, they're like, well, maybe I should, check it out myself and see what's going on. The other thing is, even because of the stigma that ADHD is hyperactive little boys, if a girl is successful, she's academically achieving and quiet, we start thinking that she doesn't have ADHD.
Yeah.
But in that case, it's actually more internalized, and it's an internal struggle that she's dealing with. And that's where these people are missed, and it becomes harder to diagnose them. IQ also plays a big role. So IQ. So the higher your IQ, the more adaptive you are, and you're able to compensate. So compensation happens, in different ways. Whether you learn certain verbal cues to use, body language use, humor, when it's appropriate. So you hide it. And
so bigger the IQ, better the ADHD, kind of?
The higher the IQ, the harder to diagnose ADHD.
I see.
Because, IQ helps you with life. So you're successful. You're having a good, family, friend circle. People look at you like you're actually a role model.
Yeah.
They're like, I want to be like him or her. And then you realize that, but internally they're struggling, and they're internalizing all this, I guess, trouble in the pathways, and the issues they're having. And on the surface, you're like, oh, this is someone that's very successful.
Yeah.
They're happy, they're comfortable, but the brain is suffering.
Interesting. I didn't know the association. I didn't know actually that the IQ actually can impact not really the symptoms, but the way you're showing your ADHD and the way that you're hiding maybe your, I don't know, maybe if you have some thoughts and if you have some doubts about, your behavior, or people see you that you're super successful, but then internally maybe you're battling with your own, I don't know, instabilities.
Exactly. And it's affecting you. It's affecting you in different ways. So, ADHD affects our sleep. It affects our self-esteem. It affects our ability to feel emotions. So in ADHD, emotions are very intense.
Yeah.
And if we get frustrated or angry, it shows up as we're, very irritable people.
Yeah.
But all that is, as your IQ is higher, you're able to mask. And when you mask it, to everyone else, even to, friends, family, maybe a psychiatrist or a therapist, they're like, yeah, but, you're fine.
Yeah, you're fine. Yeah.
There's nothing wrong, but, definitely it's there. Yeah.
And okay, let's start from the beginning. What's the difference between a person who has ADHD and a person who hasn't? Is there something that activates in their childhood, or how can you activate ADHD?
Okay, so ADHD itself is a neurodevelopmental issue, meaning that we're born with it, but the activation happens throughout life.
Okay, can happen anytime?
It can happen anytime. So what helps mask it early on in life is structure.
Yeah.
A child, with his parents, at school, with teachers, they have a structure.
Yeah.
So yes, they can be hyperactive, they can talk a lot, they can jump around, but they have their moments, and then structure kind of realigns them.
Yeah.
Once they move on to college or work, they lose that structure and there's more autonomy.
Yeah.
And autonomy becomes much harder to control because now you need to make the decision, you need to initiate, and we know that we have the procrastination part, we have the...
You have to manage yourself.
Exactly. So that's where things show up. And stress itself can also make ADHD symptoms more obvious or more prominent.
Yeah.
And, that's because you're just, off. Things are not the way they're not perfect.
Yeah.
And you still have to deal with it. And in a normal brain, it's much easier because, we all deal with stress. We can all feel overwhelmed or, anxious at times.
Yeah.
But if this is constant and it's a constant kind of feeling on edge, it makes it much harder to deal with and much harder to manage.
Omar, I've heard so many times that ADHD actually comes from traumatic events that are linked to abandonment. But from what you're saying, it seems like it's something that it's more genetic. What's the truth?
So it is more genetic. It's not coming from trauma. What happens is that ADHD symptoms can mimic other psychiatric conditions, like depression, like anxiety, like trauma, like sleep disorders. So people that truly have these psychiatric conditions get diagnosed with it, but in the background they might have ADHD, and it's a false diagnosis. And a lot of times what happens is when we start treating them for, let's say, anxiety or depression, they don't respond.
Oh,
and that confirms to the clinician that, okay, this is something more than just what you see on the surface. And I think that's where the connection is happening, is that we're thinking that trauma is actually triggering it, but it's a neurodevelopmental condition that's already there. It just needs the environment to really appear and to cause the effects that it does on people's lives.
Yeah. And before diving deep into the environmental part, which I'm sure it plays a big role, for people who still don't know exactly and they wonder, do I have ADHD, do I not? Tell me exactly the symptoms of ADHD.
Okay, so again, like we subclassified it. And by the way, they used to call it types, but now they want to present it as presentation, how it's showing up. So if we look at inattention, for example, so someone that has trouble with focus, someone that kind of daydreams, someone that has trouble with retaining, so there's forgetfulness. This is kind of what the inattention, matches.
The inattention one, the first type that you mentioned at the beginning.
Exactly,
Okay.
ADHD, inattentive type.
Yeah.
And it's to the point that, simple things like watching a movie, they just can't retain the plot. They're already way ahead. They actually, it's funny with ADHD, people will usually sit and watch the first 10 minutes and they already know what's going to happen. So then they lose attention because they already, got to the plot. And
It sounds like me, by the way. Yeah.
So that's one symptom.
Yeah.
Then if we go to hyperactivity, like we were saying in kids, is more the obvious, jumping off the walls, running around, not sitting still, fidgeting, seeming,
Maybe talking fast? Is it
talking?
a thing?
Yeah, I mean, talking fast can be, but some people talk fast by nature. And this is, I'm happy you started talking about this to connect the symptoms. The most important thing to differentiate between normal, talking fast as an example, being anxious sometimes, feeling overwhelmed sometimes, and ADHD is constant. And sometimes people don't feel it constant because they're high IQ, they know how to manage it, so they forget that that's not normal. Or to them, that becomes the normal.
Interesting, yeah.
Internally. And once they realize that, okay, well, my friends, my family members, my colleagues, they don't deal with what I deal with, then they start connecting the dots and they're like, well, maybe I need to be assessed at that point. So I think when you talk about the symptoms, just so you don't get confused, and when people, see the posts and different things like that, just realize that ADHD, it's constant. It's not something that comes and goes. It's not something that sometimes, it's not situational. It's a constant battle. And because, you might be really good at adapting, you normalize it.
Yeah.
But that constant feeling puts a lot of strain on you. Yeah. And affects people around you.
Yeah.
People around, whether a partner or, colleagues around someone with ADHD can feel stressed.
Yeah.
So the person's stressed and the people around them are stressed.
Absolutely.
And it's a constant thing.
Yeah. And so you mentioned the first type, you mentioned the second, which is the hyperactive.
The hyperactive. And then what I was going to say, in adults, hyperactivity is restlessness and impulsivity. So the best two examples is interrupting others and having trouble standing in line. That's for adults. And trouble standing in line is not that you're fidgeting or that, but you get frustrated. You're like, the worst thing you can do to yourself is go stand in line, whether it's at the grocery store or, at the airport. Or you're internally you're struggling. Yeah. And you will, stop yourself from making a scene or from, making it too obvious, but internally you're feeling that urge to speak up. And then the combine is a mix of both.
Yeah. Okay. Does it show up differently in men and women?
So women tend to have the inattentive type.
Okay.
And what that means is, I guess men usually can be impulsive, they can be loud, they can be disruptive. And okay, he's a guy, Yeah. Women are more refined. They tend to, internalize, and they tend to deal with it internally in terms of the struggle of inattention. So they usually they compensate, or they're able to adapt better than men, and they're able to use a couple of tools. So one of them is to become a perfectionist. So becoming a perfectionist in women sometimes means that they're actually dealing with ADHD, and they're doing that to mask the inattention.
This is something unexpected. I wouldn't say it. Yeah.
Yeah. I mean, it's a skill, right? Yeah. And it's a skill they're born with, and they're able to
so
use it.
It's a way kind of like to regulate your chaos.
Exactly. And it's your chaos that's internal, so you're reflecting it externally as a perfectionist.
Interesting.
And then, obviously their ability to kind of be successful and all that makes it hard to diagnose as well. Because once you're a perfectionist, if you're very successful, then it becomes like, okay, you don't have any problem. Yeah. We want to treat someone that that is struggling, and
Yeah.
having trouble succeeding in life. So.
Yeah. So you also said when we got in touch the first time that the environment you're in, if you have ADHD, plays a big role because it can impact your symptoms. Can you please tell me more about it?
Exactly. So what happens is we already know that it's a neurodevelopmental condition and
Yeah.
that it needs the perfect environment. So nowadays, we're multitasking all the time. We're jumping, from one project to another. We're getting all these notifications, whether from our phones, our
Yeah.
watches, our cars even beeping at us for,
Yeah.
lane or something. So I think all that is an environment that makes ADHD flourish.
Thriving, yeah.
And that's probably why people that don't necessarily have ADHD are starting to feel like maybe I need to check myself because they're flustered with
Yeah.
all these distractions in life, and that's how environment really plays a big role. That it's always demanding our attention,
Yeah.
but then it's never full attention, and then you're jumping.
So I wonder, for example, if there's a person who has ADHD, and let's say we have two examples.
Okay.
One person is in a very, very quiet environment, like maybe like a 9 to 5, very structured, very like he knows what he's doing and everything. And then there is another one who's maybe like, I don't know, let's say like entrepreneur, and then constant traveling, constant stimulation, constant deadlines and everything.
Mm-hmm.
So I assume that the second person is actually have the tendency to have more symptoms as lack of sleep, irritability and everything compared to the first one. And maybe the first one can cope better maybe with the structure. Like more structure you have, maybe you cope.
100%. And, what you said also comes with other things. So one of the things is that the person that's doing the 9 to 5 at an office, let's say, has a manager. So a manager plays the role of parents or teacher for them,
okay.
without them realizing, right? Because that's,
Yeah.
they're not
So
the
they
parent.
give direction.
They give direction. And the entrepreneur doesn't have that.
Yeah.
And he has a million ideas and he, wants to be successful. So he's jumping project to project. So definitely that's probably what, will put someone in the, perfect environment to really become more ADHD and to have more trouble with it and with managing his symptoms.
Even if, Dr. Omar, I don't know if you agree with me, but I still cannot name an entrepreneur who thinks that he doesn't have ADHD. I met so many that they do have ADHD, like big ones.
You see, this is one of the posts I'm sure people saw online, is that you have to use your ADHD, monetize it.
Yeah.
And that's what these entrepreneurs are doing. So
Yeah.
they're able to monetize their ADHD and the jumping project to project. And I think, just looking back at corporate life, the best managers are the ones that come up with the idea, but know to assign the right people to do it.
Yeah.
So you get the spark and you assign it, so you have a good surrounding and an entourage that can support you 100%.
Yeah.
And I mean, clearly you would be very successful because you have that ADHD brain that's able to juggle a million things at the same
Yeah.
time, but you're never going to finish the task, but you have the people to finish it for you.
Yeah.
And at that point, it makes sense.
Yeah. Does it affect also relationship when it comes to romantic relationship or friendship? Is it affecting?
So 100%. So, I mean, in relationships, I think the hardest part is the partner might not understand or know that the person has ADHD. The person themselves doesn't know. And internally, emotions are very intense.
Yeah.
So when they're upset, they're really upset. They can feel, frustrated, irritable, and obviously, for something that the partner is looking at them, it's like, that's not even really a big issue, There's also the issue with forgetfulness, not being a good listener, having kind of trouble, remembering dates and things like that. And then that is, misinterpreted as not caring.
Yeah.
But it's not really something, related to that. It's purely the ADHD that's
Yeah.
acting, and that's the struggle, really. That's
It's so funny because the reason why I started to dive deep into ADHD more is, first of all, because I struggle with sleep, so I always wonder if this is connected to hyperactivism and everything, and maybe ADHD. But the second reason is because last year I was dating a guy with severe ADHD.
Okay.
And like he was in the entrepreneur and music industry. So, and traveling every now and then, probably twice a week, I'm not joking. So, of course, the environment played a huge role on his ADHD because he had a very disrupted life with no discipline. Like every day was different. And I remember when I started dating him, I was so confused because it was so like full of life, curious, and I really liked that part. However, I will never forget that one time we watched a movie. No, we didn't watch one movie. We watched 3 movies, 10 minutes each, because he couldn't concentrate on them both. So I was just like shocked. The fact that he was forgetting to text me. Like I like completely, even though like he knew, but he just forgot. And it was talking very fast, interrupting every single time, like sleeping 0, like 4 hours maximum. And I remember that I was so overstimulated myself. And every time I was trying to dive deeper into, talking about emotions, how do we stand, how do you feel, blah, blah, blah. It was so difficult because I just met a wall. So, and then when actually we split, he decided to just call it to an end. And even the way he did it was so drastic and so dramatic, like a cut, that I felt like, I think another person would have dealt with the closure, with the breakup, in a way that is kind of like more smooth and gentle. And he was very like vomiting his emotion. And what did he feel? Like even things that he was not supposed to say.
Yeah.
And then I realized, oh, okay, this is the clear example of a person who has ADHD. And because of his environment, he kind of like, he's disrupted, but he's also thriving.
Yeah.
Like the reason of his success is actually, like the reason why he's so successful is because he has this way to be everywhere, every time. So for me, it was a very curious example of like a person with ADHD. Okay, he has attention span and everything, but he also has a superpower.
Yeah. Yeah. It's, the way you put it is you describe the stress that partners, with someone with ADHD experience. And at the same time, you don't want to turn off their light because you see that they're very successful. So you don't want to dim their success.
I couldn't stop him. I couldn't even, like during the plans and doing this, like you cannot stop the flow.
Yeah.
I couldn't stop the flow.
Yeah, it's it's a double-edged sword. Let's put it that way. I mean, because I think, if we look at it in general, part of being successful is being successful at most things you do. So, being able to kind of, you don't have to have everything, but at least you're able to fit. And maybe success is different from person to person when they think about it. Whether it's I have a very good career, but then I don't have friends or a life or a family. But a lot of times, I think for most people, and the benefit of knowing that you have ADHD and treating it is giving you that balance.
Yeah.
Where you could, be successful and in your eyes and in people's eyes that, okay, I'm happy with what I accomplished. I'm happy with my career. I'm happy, to have a family. I'm happy to have friends and being liked. And treating ADHD can definitely give you that, especially if it's causing that disruption. Because again, some people they, like the example you mentioned, very successful, but probably not
Yeah.
many
No.
friends, very difficult to have a
So,
meaningful relationship.
Yeah.
And, maybe that's not what everybody wants.
Yeah,
So,
exactly. When it comes to solutions right now, another thing that I think is one of the most, this is the thing that people are upset about when it comes to ADHD is the executive dysfunction. How would you deal with this? Because this is something that it will present in front of you daily.
so executive dysfunction means issues with planning, organization, task
Completing a task.
task initiation, completion, not getting distracted while you're doing the
Yeah.
task. And the simple things that people can do is to break tasks down into smaller pieces. So, for example, I guess the issue, people that have issues with executive function is that they know they need to do something, they know they need to do it, but they just can't get themselves to start it.
Yeah.
And when you break down the task into smaller pieces, simple example is I need to clean my home. But instead of saying I need to clean the entire house, you can say I'll start by picking up 5 things. So doing that actually gives you a breakdown to this, initiation. And once you start, the momentum will keep you going. But the structure and the breaking down of tasks is what will allow you to not rely only on willpower and motivation, because that's really the issue. Dopamine is affected, and dopamine is in charge of motivation and reward. And you need to do things, but it's hard to start them. So you have to help yourself with these these tools.
And I assume that actually dopamine plays a big role when it comes to ADHD, because I know that it has a tendency to get excited very easily and then drop it. And this roller coaster is something that maybe it's very familiar. I think dopamine is something that on a healthy level everyone should have, because it keeps us going. But what's the relationship between dopamine and people with ADHD, and how to deal with it?
So in ADHD, there's an imbalance in the dopamine pathway. So it's just different.
Yeah.
So I guess the best example is if you're going from point A to point B, non-ADHD brain, you go straight line, right?
Yeah.
It's the shortest way. But with ADHD, point A, and then you go round and around and around, maybe to, X, Y, Z.
Yeah.
Eventually you'll make it to B. But that struggle happens with dopamine in the brain. And that's why, even, I guess ADHD is not really lack of focus, but it's inconsistent focus. And what that really means is that people with ADHD, if they do a task that gives them fast reward, gives them, the feeling of accomplishment, they will be very focused on it. And that's what we actually call hyperfocus. And dopamine is what does that, right?
Yeah.
Because if they're doing a mundane, routine task, they're just, like cleaning your house is mundane and routine. So there's no reward from, it's nice to have a clean home, but it doesn't give you the feeling of, motivation or reward that makes you just want to do it and go for it. And that's the issue with ADHD. So it's not that they don't have focus, they just have inconsistent focus, and then they start hyper-focusing on rewarding things only.
Interesting.
And that's where dopamine kind of plays that role.
By the way, what's the difference between being easily distracted and not attentive and losing focus easily and be ADHD? Because the reason why also I wanted to invite you on the podcast is because nowadays we don't have a good attention span. Everyone is kind of like unattentive when it comes to, because of social media, life and everything. And sometimes we think that just because we do not pay attention and we don't have a good attention span, we have ADHD. What's the difference between the two?
So the difference is consistency and situation. So meaning that in normal person, you can be distracted occasionally, you can feel overwhelmed occasionally, but it's not a constant thing, and it's not something that you struggle with on day to day.
Yeah.
In ADHD, it's consistent. It leads to strain in relationships, at work. It leads to self-esteem issues. And that's where you know that, okay, no, this is more ADHD than just, the occasional distraction or the occasional inattention. And then, like we discussed, environment plays the role. So it's going to happen to all of us.
Yeah.
But is it getting to a point where it's affecting you on so many aspects and it's constant? Or is it just something that, if I don't sleep well the night before, I'm more, I'm distracted more easily.
Yeah.
That happens.
Yeah.
It's not something that's unusual. We're human, so we have our limitations.
How can you get tested for ADHD? Because there are so many crazy tests on social media, like with images and colors. And I'm like, I wonder if this is true or there is only one test. What is the test?
So it's not just a test. It's really a complete kind of history taking. A lot of times it needs to go back all the way to childhood to assess. And what happens is that in childhood, it sometimes is missed. So people think that, what they were doing back then was normal, but to a clinician, a professional that really understands ADHD and can evaluate it, they realize that that was the first sign.
Yeah.
And then you start looking at, like you mentioned, questionnaires, computer-based tests. There's different things, but it's not one, tool that if you do this test, for sure you have ADHD.
Okay.
And that's why it's difficult to self-diagnose because, with the social media, everybody wants to self-diagnose. They want to take the quick test and, you have moderate ADHD. But it's more of a full comprehensive assessment, including history taking, including questionnaires, including, different computer-based tests. And once you assemble all this, the clinician, if they're a family doctor or psychiatrist like myself, they can prescribe you medicine as a trial. Sometimes we try the medicine to know if for sure it's the right thing.
Yeah.
There's also counseling. There's also, coaching that can help. And combining everything together is how you reach the final diagnosis, basically.
And is it something that you can easily do it here in Dubai?
Yes, it's readily available. I mean, Dubai, we're lucky to have, all the latest treatments and assessments and all this.
Is there like a specific center or you have to go to your doctor and then how would you do it with your clients?
So typically what happens is if you have your own family doctor, which obviously is a good thing, to have a routine checkup and see your doctor regularly at least once a year, you can bring that up, bring this information up with your doctor. If they are comfortable doing it, they can do the assessment for you. If not, they would refer you to a mental health clinician. Typically, the psychologists are the ones that spend the time going through all the testing. Some places it takes 2 to 4 sessions, let's say, to reach a final diagnosis. And once you're diagnosed, the psychiatrist or the family doctor can prescribe you the medication if that's the appropriate.
In which cases you prescribe the medication and for people who don't want to be on medication, but they just want to go in a more holistic and natural way?
Yeah, so
what do you think?
Honestly, with anything in medicine, it's a combination of, with anything in medicine, it's a partnership between the patient and the physician. So as a doctor, I would never tell my patient, you have this condition, just take this medicine, this is what you need to do. No, we discuss the options. We discuss the option of treating, of not treating, of treating with coaching, counseling, different behavioral changes that the person can do to improve the ADHD. And we give the option of medicine. And honestly, in treatments in general, in medicine, combining different modalities, multimodal, gives you the best outcome.
Yeah.
So using different modes of treatment combined will actually help us reach the best outcome. Yeah. So it's not a one-way kind of treating it, but it's a multimodal. It's a discussion between the patient and the doctor. And that's why it's good to have your own family doctor, because you're comfortable with them and you're comfortable to open up to them and talk to them about multiple things. So it becomes natural for you. It's not just, a new person that you're meeting for the first time or
Of course. And what are actually the best supplements for people who struggle with ADHD, if you would recommend some?
So nowadays supplements are very popular.
Yeah.
So I mean, you have things like omega-3, for example. We know that omega-3 plays a role in brain health.
Yeah.
Magnesium, it's very good for sleep and relaxation. Zinc has a role in, neurotransmitters in the brain, so dopamine and things like that. But supplements, they're there to support, not to treat.
Yeah.
And I think that's what people need to realize. And this is, by the way, with any medical condition, you hear about, my friend takes these supplements and he feels, like $1 million, but then you take the same ones and you don't feel anything.
Yeah.
So you're like,
No, because I heard so many things about, for example, ashwagandha is a very well-known supplement for relaxation and relief and everything. So I wonder if maybe supplements as ashwagandha or, as you said, magnesium, they would affect somehow.
So I think that, they might help. But I think it's also good, to discuss it with, a clinician.
Yeah.
Because nowadays you can just buy 1 million types of supplements. Like one of the popular things now as well is L-theanine. L-theanine is the difference why coffee and matcha work different.
Yeah.
I think a lot of people realize that. So caffeine, gets spikes and troughs. Matcha has caffeine and L-theanine. L-theanine works really well for kind of smoothing out, the effects. And that's why you don't really get the spike and the dip.
That for me, it's so interesting because I cannot drink coffee because I feel completely sleepy, but I can drink matcha, which I never really understood why with coffee, I feel so sleepy that I want to go to bed. And with matcha, I feel energized.
It gives you opposite effect.
Yeah.
But you see, that's the L-theanine in it. So L-theanine actually comes as a supplement as well. So, I mean, when you think about supplements, yes, they might help. It's probably not going to hurt. I mean, omega-3, you're taking it even for your cholesterol, which is not a bad thing.
Yeah.
Exactly. So omega-3 makes sense. Magnesium makes sense. Magnesium is very good for relaxation. It's good for people that exercise, so it's also good for that and the brain. Zinc is definitely useful. B12 vitamins are excellent. Supplements will not treat things, but they will definitely support you in case there's a deficiency in it. And then if you test and you know for sure, that's even better because then you're really targeting something that you're deficient in. So,
random question. Do you think that people with ADHD should partner up in life, in career, in love with other people with ADHD?
I think that would be useful if they both know and they both are properly diagnosed. But I don't think it's a must. And I think now with the culture shift, and hopefully, through things like your podcast, people will realize that it is a condition that, deserves support, deserves, highlighting and understanding it more, and realizing that just like everything in life, we're different, and ADHD brain is different, but it's still human brain that deserves attention, deserves care, and can definitely is part of life. So we just need to know how to understand it better.
Do you have ADHD?
You can tell just talking to me.
I cannot tell, honestly.
You cannot tell. So I do have ADHD. I actually. So I got diagnosed at age 40.
Very early.
Yeah. Well, actually very late, right?
40.
40.
40. I thought 40. No.
No, at age 40. 40. So I had been treating ADHD for a long time. I mean, it's part of my bread and butter every day.
How have you decided to focus on ADHD? After you got diagnosed or after?
No. I already, because like when you, family doctors in the US, they're trained really to kind of, treat everything and to be comfortable dealing with everything, because again, I do send my patients to specialized care when they need it, But if it's something that I can manage, I definitely want to participate. And they actually prefer that. Patients, when they're close to their family doctor, they just, they trust you.
Yeah.
I had been treating ADHD for many years, and I basically went through a divorce, and at some point I was like, well, I think it's time to figure out what's going on, and it was because I wanted to understand more. I'm treating people with ADHD. One of the things that were said, during the process was that, yeah, your mom always thought you had ADHD, something that was just thrown out. And, during a fight, you don't really pay attention to, the depth of the words. But then when I looked back, I was like, that word was said, and maybe I should take it serious. Maybe I should, dig into it more. And I initially went to a psychiatrist. And, psychiatrists, they tend to be more medication driven. They're like, okay, well, I talked to you for, 30 minutes to an hour.
Yeah.
I'm already an experienced psychiatrist. I know what's going on. You have ADHD.
Like this. Yeah.
Exactly. And there's two ways to treat. There's stimulant medications and there's non-stimulants. So actually, first line treatment is stimulant medication. Second line is non-stimulant. So we usually leave it for someone that can't tolerate stimulants or, for different reasons. One of the reasons why I was going to start with non-stimulant is because it wasn't available. Stimulants weren't available. So, the psychiatrist was like, just take the non-stimulant. When I started it, it actually worked really well. And it made me curious to have a more in-depth evaluation to even try stimulants. Because at this point, the hardest thing about getting diagnosed older is that you wonder what you could have done if you were treated early on. And, I'm saying this as, a doctor, and, people are like, oh, well, you're a doctor. What else would you would have done in life, But you're curious because you want to know. So what,
also
how
the
would
reactions, the different.
Exactly. Different things that, I don't know, maybe, career paths.
Yeah.
At some point I thought I want to be a pilot,
Yeah.
It's like, I don't know. So I started thinking maybe I should have a even deeper evaluation and diagnosis. And that's where I did the full, 4 visit consultation with a psychologist through a different psychiatrist. And then when I went back to the psychiatrist, it's funny because the psychologist, that's where I was talking about IQ and things like that. She was like, you really have severe ADHD, but we can put it as moderate because you succeeded in life and because of your IQ. So you managed to reach this level.
Because there are levels, not only types.
Exactly.
Okay.
So there's also levels. So there's, mild, moderate, severe. It's kind of like pain, if you have severe pain, medium pain, low pain. And she put my diagnosis as moderate ADHD, but she told me you really have severe, but because of the IQ, you just wouldn't fit in the severe. And I tried stimulants, and the first thing that happened was my nurse at work noticed that I'm very calm. Yeah. Calm under stress. Yeah. So, stress, sometimes you get double bookings and you have many patients coming at once. She was like, Dr. Shafie, you're like a different person now, And it's funny because that rang a bell with me back in residency. I actually did a year of general surgery residency, and then I switched to family medicine. Yeah. And during my general surgery residency, you can imagine, training to be a surgeon is very, very, very stressful.
I can imagine, yeah.
Not enough sleep, just so much going on, all the environment that produces ADHD. Yeah. And I had a student, a medical student that worked with me as a general surgery resident and then switched over to family medicine as I switched. And the first thing they told me was like, you're actually really nice. So my treatment surprised. My treatment for ADHD then was just removing the stress, removing the excessive stress. And when my nurse said that, after I took the medicine and I used it for a while, I realized that, stress plays a huge role of how your ADHD acts and how you act under that stress, and then you appear irritable and frustrated and just a mean person when you're not a mean person, but your ADHD is making you seem that way.
Wow.
And now I'm off treatment. I don't take medicine anymore. And the reason why is because I realized how my brain and my, behaviors are on the medication, so treated, and off the medication, and I'm able to pull myself back in to non-ADHD brain.
But that's a very high achievement.
It is, and I think I'm hearing that a lot from my patients that I treat that have been on medicine for a while. A lot of times they can come off the medication. I think back to the stress part, so that also plays a role. So, sometimes changing jobs or doing a more laid back job, less stress, relationships, these things play a big role.
Absolutely.
So I think, that is probably in addition to experiencing how ADHD was with medicine, without medicine. And changing the environment on different levels.
And sometimes because we think that something is so normal that we use, as you said, like if you're used to lack of sleep, if you're used to irritability, if you're used to not be super attentive, okay, you can kind of like self-regulate yourself. But at some point, as you said, the difference is that ADHD is consistent.
Exactly.
And then if you don't know how you are when you're calm, when you are like, I don't know, maybe you're not over emotional, unless you don't try what's on the other side, you cannot really self-regulate and you don't know what you're doing wrong.
Exactly.
So I think maybe that's why you were able to track your behavior and say, now I can see it from an objective, I pull myself out, now I can see myself, now I know how to regulate.
Exactly.
Yeah,
you step back and look in. That's what we need to do a lot of times.
Zoom out
and look in, and then you realize, that it's manageable and you can deal with it.
Dr. Omar, where people can find you if they want to come to you and maybe start this journey with you?
So right now I work at Dr. Sulaiman Habib in Healthcare City.
Yeah.
And I typically am off on Friday and Sunday, but otherwise I'm available from 8 a.m. till 5:30.
Perfect.
Yeah.
Dr. Omar, thank you so much for being with us. It was a lovely conversation.
It was a pleasure.
Guys, if you have any questions, please comment down below. Do not forget to subscribe, and I'll see you on the next episode.